A very good evening to everyone. This is Shubham. Welcome back to Medical Concepts. First of all, I would like to thank you all guys for appreciating these videos. It really motivates me to make more and more videos for you guys. So the topic today which we are going to talk about is mesenchymal tumors. So look at the very first question. There was detected a solid movable tumor clearly delimited from neighboring tissues. It was of white color on the cut surface and presented with the fibrous tissue. Microscopically, there was seen chaotic plexiform collagen fibers. Now, what is chaotically plexiform collagen fibers? Means like these collagen fibers are arranging haphazardously. So cell quantity is minor. Term the tumor over here. So look, what kind of tumor are they talking about? Actually, they are talking about the fibroma over here. Now, how can we reach the diagnosis that this tumor which they are talking about is fibroma? Look, they were saying that a solid movable tumor, and that was clearly delimited, means that was separating from the neighboring tissues, isn't it? And these fibrous tissues, microscopically, if you will be saying that they are actually chaotically arranged, chaotically plexiform collagen fibers are there, right? So look, let me talk about the fibroma. Some words about the fibroma. Actually, it is a node of differentiated connective tissue having different directions of the bands, right? Now, according to the direction of these bands, we are actually classifying the fibroma mainly into two types. One is the hard fibroma, or you can call that as dense fibroma or solid fibroma. Another one is the soft fibroma. So simply I will be saying that we will be having two kinds of fibroma, hard fibroma and the soft fibroma. In the hard fibroma, what you will be appreciating is fibrous structures, they will be prevailing over the cellular elements, okay? Whereas in the soft one, there will be the loose connective tissue, they will be having greater amount of stroma cells, okay? So listen very carefully. I am saying that in the soft fibroma, there will be the great amount of stroma cells. What kind of stroma cells am I talking about? I'm talking about the fibroblasts and fibrocytes, because they are including in those stroma cells. So what I said in short is that fibroma, this is the differentiated node of differentiated connective tissue. They are having the different direction of the bands. According to the direction of the bands, we are having two kinds of fibroma, hard fibroma and soft fibroma. Hard one, in this one, fibrous structures will be there, they will be arranging or prevailing over the cellular elements. Soft one, there will be the loose connective tissue with great amount of stroma cells, fibroblast and the fibrocytes, okay? They are the part of the stroma cells. In our question, they said yes, that there was a delimiting neighboring tissues, isn't it? They clearly wrote over there that solid movable tumor clearly delimited from the neighboring tissues, white color on the cutting surface, that's okay. Fibrous tissue, fibroma, fibrous tissue, isn't it? Microscopic chaotically plexiform collagen fibers over there. Cell quantity is minor. However, they didn't give in the option that is it hard fibroma or is it soft fibroma, but for making more trouble for you guys, they might give you the options, two options where you need to differentiate between the hard or soft fibroma once you make the diagnosis of fibroma. First of all, you need to reach to the diagnosis of fibroma, and then only you will be able to recall that whether it is hard fibroma or soft fibroma. So first of all, you need to know the finding which will be writing in the MCQ if they are talking about the fibroma. So I said that delimiting neighboring tissues, you can say these kind of fibers or node of differentiated connective tissue that will be seen, and fibrous tissues, they are saying collagen fibers they are talking about, okay? So means they are talking about the fibroma. In this particular question, if they will be asking you which fibroma, hard or soft, however they didn't wrote in the option, so it is easy for you guys to pick up that they are talking about the fibroma. However, I am saying if the option will be like this, is it hard fibroma or soft fibroma, then your answer will be hard fibroma, or you might write it that as solid fibroma, or you might write it that as dense fibroma. Why I am saying so? Because look, they clearly mentioned that they were saying cell quantity is minor. I said that in the soft one, there will be the great amount of stroma cells, fibroblast or fibrocytes. Okay, great amount of stroma cells will be present, more amount of stroma cells will be present, but here the cell quantity is minor, which clearly indicates that it can't be the soft fibroma. So the answer will be the hard fibroma or the dense fibroma or the solid fibroma, whatever you would like to call it. Okay, so with the discussion of this one, I hope you got my point. Let me talk about the question number 80. In the skin, a soft movable tumor was detected macroscopically. Okay, microscopically, what they said, chaotically arranged, guys. Again guys, they are talking about the chaotically set fascicles of collagen fibers. Again they are talking about the fibroma, and you know they said that solid movable tumor. In the previous question also they clearly mentioned that that was the movable tumor, isn't it? If I would like to show you over here, that in the 79 question they said also that they were detected a solid movable tumor, right? So they are talking about the fibroma now. Okay, fibroma in the question number 80, right? Yes. So with a little amount of spindle cells, what tumor was removed? Again same thing. So little amount of spindle cells, I told you if there will be more amount of stroma cells or the spindle cells, then your answer will be soft fibroma, otherwise you will be going with the hard fibroma. So again your choices are easy one, rather I would say, because they didn't mention about any other choice, because all four choices are the different ones. So your answer becomes very simple over here as well, that they are talking about the solid fibroma or dense or hard fibroma or hard fibroma, isn't it? If they will be giving the choice of soft fibroma, which may appear in the upcoming MCQs or in your exam, so please remember that differentiating point, and that how will you differentiate between the solid fibroma and the soft fibroma. Moving on, question number 81. A uterus removed in the course of an operation was delivered for the histological examination. Multiple nodes of round form clearly delimited from neighboring tissues were detected under the mucous membrane. Microscopically, tumor consists of fascicles of non-stretching muscles with tissue atipism. Now remember, if they are talking about some kind of mitosis in the tissues or tissue atipism, right, they are talking about some kind of there can be some kind of malignancy, right, with that. So over here what they are talking about, please focus over here, that they are saying uterus removed and clearly multiple nodes were there, clearly delimited from the neighboring tissues, and microscopically what was the finding? Non-straight muscles with the tissue atipism. So look over the image which I have inserted for you guys. So look, this is the image of uterine fibroids, or in other words you can also say it like that, we can also call it that Leiomyoma. Okay, Leiomyoma. Now what is Leiomyoma? Leiomyoma and the uterine fibroid, they are the same thing. So look, there are several types of uterine fibroids, but if you want to remember the types of the fibroid, that's okay, but if you will not remember also, that is also fine, because these things you will be studying in your gynecology and obstetrics part in your 5th course. But for now what I want to say is that they are, in this particular question they are talking about the uterine fibroids, also called as Leiomyoma. So what you can appreciate over here, there are different types of fibroids over here, but let's say the first one, that is the pedunculated fibroid. Pedunculated means some kind of extra growth coming out of the tissue, isn't it? And now in the question also they clearly mentioned that uterus removed but multiple nodes of round form clearly delimited, look over here, clearly delimited from the neighboring tissues, right? So there might be the possibility that they are talking about the pedunculated fibroid over here. However, it will be injustice for you guys that if they will be asking you the type of the fibroid, because it's beyond your scope for the 3rd course. But this particular question they are talking about the fibroid, that is for sure. So you should actually at least know that they are talking about the uterine fibroids, also called as Leiomyoma. Okay, so your answer will be over here is the Leiomyoma, and I inserted the image for you guys, which actually makes it very clear for you that I will be talking about the structure as well. Let's say that this is the boundaries of the uterus, and this is the fallopian tube, isn't it? And then it will be continuing into the ovaries. Over here you might appreciate the ovaries, and inside it will be the uterine cavity. I'm not writing, I'm just saying it's a uterine cavity, and different kinds of fibroids you can appreciate over here. Okay, I'm not going into the detail of the fibroid, which kind of fibroids you're talking about, because it's beyond your scope over here. Fine, so let me move on to the next question now, and we'll be talking about question number 82. I hope you got my point in the question number 81. A painless new growth without clear borders appeared in the soft tissues of the left thigh of a young man. In the new growth biopsy material, the tissues looked like fish meat. Okay, consist of immature fibroblast like cells with numerous mitoses that invade muscles. So two things which you need to look over here is that first they are talking about the fish meat, and secondly they are talking about the immature fibroblast cells, and one more thing, third thing, which is the numerous mitoses that invade the muscles. First of all, let me tell you that if they are talking about the fish meat appearance, that means they are talking about the sarcoma. First thing you need to remember is this one. Now you will be asking me that two choices of sarcoma are actually given, fibrosarcoma and the myosarcoma. Other three can be easily ruled out, isn't it? So I will be making the things easier for you guys now. Look how to differentiate between fibrosarcoma and the myosarcoma. Myo is including the component of muscles, definitely, but here they didn't involve the muscle. Yes, they said the numerous mitoses that invade muscles, but you need to see that they are also talking about the immature fibroblast cells, isn't it? Now let me talk about the fibrosarcoma in some detail over here. So what happens is that in fibrosarcoma, first of all it occurs in the deep tissues. Okay, deep soft tissues, and it is actually showing the three things. Now three things which you need to note down over here is, I will be providing the notes as well in the description box below, as I am providing for the previous videos as well. I will be providing for this video as well, but I will recommend you to write in your notebook as well. Three things you need to remember for the fibrosarcoma for your MCQs purpose. First thing is increased fibroblastic cells. Second thing is anaplasia, okay, which comes out of the dysplasia component, and then finally it can lead to the cancer. And third thing is abundant mitotic figures. So I repeat, first thing is increased fibroblastic cells, second one is anaplasia, and third one is abundant mitotic figures. Okay, out of these three they actually mentioned about two at least. You should be seeing over here immature fibroblast like cells they mentioned, and numerous mitoses, isn't it? So two components they already mentioned. Third component can be anaplasia as well, so I am writing it over here as well. Third component might be the anaplasia, right? So here what should be the diagnosis over here? Fibrosarcoma. Why sarcoma? I told you that fish like appearance, fish flesh like appearance can be seen macroscopically if we'll be talking about the sarcoma, right? Okay, so your answer over here will be the fibrosarcoma. I hope you got my point here as well. Question number 83, macroscopically, a cervical tumor post-operative material is of soft consistence with the hemorrhages and necrosis areas. It looks like fish meat on the cut surface. Again guys, they are talking about the fish meat on the cut surface, which means they might be talking about the sarcoma over here. Histological examination shows signs of apparent cell and tissue atypism, cells with the pathological mitosis. Again, they might be talking about some kind of malignancy over here, because look, they are talking about the mitosis. Okay, now in this question I am seeing that atypism and pathological mitosis can be seen. It can be fibrosarcoma as well, but as they didn't mention other criterias, so I will not go with the fibrosarcoma, and neither this is given in the option as well. The options are very simple over here. Look, sarcoma is given simply, so let's not get into this thing that is it fibro or myosarcoma. Simply answer will be the fish, due to fish meat appearance your answer will be goes towards the sarcoma. As I already said that fish meat appearance will be seen in the sarcoma. So look, macroscopically if you will look at the sarcoma, it will looks like the fish flesh, okay, or you can say fish meat appearance on the tissue. Now what happens is that they are actually disseminated hematogenically, and tumors, they are characterized by the atypical cells, or they might be having the mitosis component along with it. So your diagnosis will be in that case, that will be the sarcoma. Let's move on to the next one. Question number 84. 55-year-old woman has a movable temperate formation 1 into 0.7 centimeter of pasty consistence with clear borders under the skin of submandibular area. Histologically, the lipocyte they are talking about, which form lobules different in form and size. were detected. A thin layer of connective tissue with vessels separate the lobules. Diagnose the disease over here. So as you can clearly see that they are talking about the lipocytes. So diagnose the disease they are talking about. So they must be talking about something regarding the lipocytes or the adipose cells or the fat cells. Diagnose the disease. All the options are regarding the tumor, as we are talking about the tumors itself. So which kind of tumor, you can easily appreciate that they are talking about, they must be talking about the lipoma, as they are talking about the lipocytes. Now lipoma, I have inserted the image for the convenience for you guys. So look, lipoma is the fatty tissue, right, the tumor of the fat cells. So fatty tissues, they are showing the bigger appearance. So this is a lipoma over here, you can easily appreciate over here, right, with the markings. Okay, so first of all there is the skin, then there is a fibrous capsule which you can easily appreciate, and beneath that there is a muscle layer present over there, isn't it? And on the right side you can see that there is a lipoma which you can easily appreciate over here. This one I am talking about. Okay, so you can easily appreciate how it looks. Okay, and in your real life also you must have been appreciated in your previous time, right? Okay, so this is lipoma. So what is lipoma? It is actually most frequent soft tissue tumor. Most probably it occurs in the subcutaneous regions. It may actually occur at any kind of site, but the most commonly there are three sites in which it is most commonly seen, right? So that is the back, shoulder and the neck. Back, shoulder and neck, these are the three regions in which lipoma can be most frequently appreciated, I would say. They can also arise in the mediastinum region, retroperitoneum or bowel wall, but most frequently they are actually appearing in the back, shoulder and neck region. It may develop in every side, as I said, wherever there will be the more and more fat tissue, there will be the more chances of developing of this lipoma. Lipomas are actually encapsulated, as I am talking about the benign tumor only, and benign tumor, you know very well that they are actually encapsulated. In the previous video I have actually inserted, and I have already talked about the difference between the benign and the malignant tumors. If you have any kind of doubt regarding that, so I would like to recommend you that you go to the previous video and clear your doubt regarding the benign and malignant tumor difference. Lipomas are encapsulated, I said, as I am talking about the benign tumor, and they are usually having the small yellow node. Why is it yellow? Because as most of you can actually know from the name, that lipoma look fatty cells and fat tissues, they are actually imparting the yellow color only. So small yellow node will be seen over there. Okay, all of the following details I will be inserting in the description box below. You can read from there as well. Question number 85. A 75-year-old patient had a tumor 16 into 8 into 6 centimeters, so a big tumor over there, removed from the retroperitoneal fat by the surgeon. Microscopically, fat cells with signs of, look, fat cells again. So fat cells means they must be talking about some kind of lipoma or liposarcoma, depending on that whether it is benign or malignant, with signs of cellular retipism. Cellular retipism is giving you the hint about the malignancy, and polymorphism. Okay, again giant deformed cells with fat drops in the cytoplasm. Fat drops means like they may be talking about the liposarcoma over here, because they were talking about the cellular retipism, isn't it? Cellular retipism. So malignancy component will come over here. So look at the options over here. So two options which we can think of, lipoma and liposarcoma, but over here I will go with the answer as liposarcoma. Why is it so? Because they gave you the component of the cellular retipism, and due to that we have to go with the liposarcoma, as they are talking about the malignancy over here. What is the lipoma? I already told you in the previous one that there is in the previous question, that is the benign component. But if they are talking about cellular retipism or more and more amount of mitosis in the tissues, okay, that means that is indicating you about the malignancy. Okay, so that's gonna be malignant tumor. As they were talking about the fat cells, peritoneal fat, retroperitoneal fat, and that big tumor was removed, so you know there is a chance that there can be the liposarcoma, right? So this is also called as lipoblastic myoma, and this is a rare. Look, these kind of tumors are rare, actually not seen very frequently. So rare and large tumor composing of lipocytes of different degree of maturity and lipoblast. Okay, so that is a liposarcoma. They might be containing some kind of metastatic property or some kind of cellular retipism and mitotic figures in the tissues. I hope you got my point. Let me move on to the next question. Question number 86. Microscopically, a tumor of the upper lip consists of multiple small slit cavities, the walls of which are covered with the compressed endothelium and filled with the fluid portion of the blood and its grooves. Okay, so they are talking about microscopic findings of a tumor, okay, occurring on the upper lip region. Compressed endothelium and filled with the fluid portion of the blood and its grooves. As you can see over here, they are talking about the compressed endothelium. Endothelium is a part of the blood vessel. Now, which kind of disease you might be talking about? So here, according to me, the answer should be the capillary hemangioma over here. Why I am saying so? So look what happens in capillary hemangioma. First of all, hemangioma is having two types. One is the capillary hemangioma and other one is the cavernous hemangioma. Hemangioma, first of all, what is this term? Hemangioma is a tumor from the blood vessel. Look, hemangio, hemo means blood, angio means blood vessel, and oma means the tumor. So tumor of the blood vessel. Several types of hemangioma can be there, in which two major types, they are the capillary and the cavernous hemangioma. So let me talk about the capillary hemangioma first. Capillary hemangioma, they are actually developing in the skin, mucous membrane, GI tract, liver, and most commonly they are occurring in the children. Okay, now they are well defined and unencapsulated. I said unencapsulated lobules. Okay, in the lipoma I told you they were encapsulated, but over here I am telling you that this hemangioma, capillary hemangioma, they are actually unencapsulated lobules. Okay, unencapsulated lobules, and the lobules are comprising of the capillary sized thin walled blood filled vessels. So in these thin walls there will be the blood filling in over there, and in our question they said compressed endothelium was there and filled with fluid portion of blood and its grooves, right? So they are talking about, they must be talking about the capillary hemangioma. Moreover, these vessels are lined by the single layer of endothelial cells, and in our question they mentioned clearly that they are talking about the endothelial cells. So what I am trying to say is, in the simple language, that there will be the endothelium which will be compressed due to these tumors, and due to the compression there will be some amount of blood filling in the bits here and there. Okay, so that is the meaning of the capillary hemangioma, and that's what they are trying to say over here. Compressed endothelium and filled with fluid portion of the blood and its grooves. So this kind of hemangioma is the capillary hemangioma. Okay, so I hope you got my point. Question number 87. During an operation, a 17-year-old patient with a Murray tumor, 4.5 into 5 into 3.5 centimeter dimensions are given. That is a bigger tumor, subseriously detected on the lower surface of the liver. Now they are talking about the liver. In the capillary hemangioma, I told you that was the location which were given over there, that was the upper lip, but over here they are talking about the liver. On the cut surface presented with the cavities filled with considerable blood content and thick connective tissue walls covered with one layer of endothelium. Over here they are talking about the endothelium. Over here they are talking about thick connective tissue. Location over here is liver. What is the provisional diagnosis? This is also the case of hemangioma, but look, I told you the hemangioma. What is hemangioma? That was the tumor of the blood vessel. I told you two major types, capillary and cavernous, out of which capillary I'm sorry, out of which capillary I already told you that capillary hemangioma, that was occurring in the skin region, mucous membrane. So for example, upper lip was the location over here, most frequently was occurring in the children. In the cavernous hemangioma, it most frequently occurs in the liver, skin, bones, muscles, GI tract. So most frequently I want you to remember that is the liver, right? And it can be the brain. Okay, most frequent location. So liver you should remember for the cavernous hemangioma. So first of all, they mentioned in the question itself that they are talking about the liver. Secondly, in the cavernous hemangioma, there can be the single or multiple cavities. Cavities means cavernous. Now you will say that cavities were given in both the questions. Okay, I understand that cavity cannot be the considerable thing which you can think of the diagnosis, but I would say over here that you should remember the locations mainly, because if they are talking about the liver, definitely it's gonna be the cavernous hemangioma. Second thing which you can differentiate from the capillary hemangioma over here, if you are talking about the cavernous hemangioma, that this cavernous hemangioma, they are containing the cavernous vascular spaces, and these vascular spaces might be filling partly or completely with the blood. Now they were saying that they were thick connective tissue walls. Thick connective tissue walls means that they are talking about some kind of cavernous vascular spaces. They are talking about what? Cavernous vascular spaces. And now if these vascular spaces will be filled up with the blood, then we will be calling them as the cavernous hemangioma. So over here the answer will be the cavernous hemangioma rather. So here the answer will be the cavernous hemangioma, whereas in the previous one that they were asking you about the capillary hemangioma. So please go through these two questions again and listen to the explanation very clearly. Let me move on to the next one now. Question number 88. An eyeball with black tumor like mass in the choroid region, 1 into 0.4 centimeter in size, delivered for the histological examination. Multiple pathological mitosis in the cells they are talking about. Okay, a fulvous pigment is detected in the cytoplasm of many cells. So what is your diagnosis over here? So look guys, as you can easily appreciate that they are saying the black tumor like structure, or black tumor like mass rather I would say, in the choroid region. Choroid region is present in the eyeball and it is the part of the uvea, I would say. This thing you will be studying in your ophthalmology, uvea. Okay, so uvea is containing the three things. Let me talk about them very briefly. Uvea is containing the three things, that is the choroid, your ciliary body and the iris. One of the component is choroid, and uvea is highly vascular structure. Okay, which means they will be having the bloody red color. So choroid they are talking about 1.1 into 0.4 centimeter in size and delivered for the histological examination. Okay, multiple pathological mitosis they are talking about the malignancy component over here. Fulvous pigment. What is the important I would say the hormone, or I would say the structure that will be giving you the pigment in your skin, for an example, and that is the melanin. If there will be some kind of black tumor like mass, so they are telling you that some kind of tumor is present in that structure which is helping you in imparting the color of your skin, let's say, and that will be the melanoma. Now two things are there. Melanoma is the malignant tumor, and two things are there. One thing is black tumor like structure, and second thing pathological mitosis, and third thing fulvous pigment is detected in the cytoplasm, which means they are talking about the pigmentary mass or pigmentary tumor, and that will be the melanoma over here. I have inserted the image for you guys for the better explanation, so you can easily see that this blackish reddish black kind of patch you can appreciate on the skin, and that is the melanoma. Okay, let's move on to the next question. Question number 89. A dark convex macula appeared on the skin of a 46-year-old patient but did not disturb him. In the course of time began to enlarge. Pain appeared. Initially the pain was not appearing, but now the pain appeared. The color changed into black, brown, and a nodule could be palpated now. Histological examination of the removed tissue showed spindle and polymorphous cells, cytoplasm of which has a fulvous pigment. So again they are talking about fulvous pigment. They were talking about nodule now, as it is enlarging and began to enlarge, pain appeared. So again, which kind of tumor they are talking about? Again the answer will be the same, that is a melanoma, because they are talking about the pigment tumor, and that will lead to the answer as melanoma. So I hope you enjoyed the discussion of the mesenchymal tumors. In the next one I will be starting the discussion with the leukemia, and if you like the video, please hit the like button, make sure to subscribe the channel, please share it with your friends, and I hope these videos will be helpful for your friends as well. With that said, I will see you in my next video. So thank you for watching this one. Until next time, bye.